Okay. Just let me know if there's any issues seeing my screen. So this morning, as Guy mentioned, I'm going to be discussing engaging young men in supportive care and really discussing some considerations for tailored approaches that are based on the literature, as well as our some of the work that we've conducted. In terms of acknowledgements, I just wanted to, at the front end, recognize that this work was conducted at the University of Toronto and at the University Health Network Princess Margaret Cancer Centre before I came over and took my post at University College London Hospital. And it was conducted in collaboration with Dr. Abby Fisher at UCL and Gemma Pugh at Queen Mary and UCL at the time. And we worked very closely with one of the charities called Truckstock. And I was able to come over from Toronto to London via a MyTax grant, which I'll talk a little bit more about in terms of some of the work that we did. So my background, as Guy mentioned, was providing supportive care within GU, so within surgical oncology. And a lot of the work that I was doing from a research perspective was in prostate cancer survivorship. But clinically, a lot of the patients that I was working with were testicular cancer survivors. And so in that role, I noticed that there were gender differences in how men and women were coping with stress, in how they were engaging or not engaging in help-seeking behavior. And when we look more broadly at the research, we see that there's low utilization of health services for men more broadly, significantly inferior health outcomes. And this may be rooted very much in traditional masculine beliefs or norms that are impacting some of those health engagement pieces. So when we were speaking to men, we were hearing very often that being diagnosed with cancer or being ill was associated with a loss of status, a loss of autonomy in terms of engaging in the healthcare system. We saw low compliance or lower compliance when it came to treatment regimes and medications. And what we see both in the clinical world as well as in research is that men tend to express fewer supportive care needs. Now, in the work that I was doing in surgical oncology and GU, it wasn't that I felt that men had fewer supportive care needs. I think we can all agree on that. And so that really triggered me to look into the why, and why men weren't engaging, why they weren't showing up to engage in either research or supportive care programming that was usual care within the hospital. And so, as I mentioned, I worked very closely with testicular cancer survivors, and they were a very unique population given that they were within the adolescent and young adult sort of group. And when I started to look into that area, because a lot of the research that I had been involved in to date was working with prostate cancer survivors. So as you know, that's a much older group with the average age in their 60s, whereas testicular cancer survivors, the average age was much younger. And prostate cancer survivors within the Princess Margaret had the opportunity to engage in different prostate cancer supportive care groups, and uptake within that was actually quite strong. But for testicular cancer survivors, there wasn't any programming. And often I'd have young men come in and ask me, are there programs? Can I engage? What are the options? And I started to look into it, and there really wasn't much for them. And so that took me into the young adult cancer survivorship role. And what we see is that it is a very small population that are diagnosed with cancer. We see in Canada that is defined by 15 to 39, but it's just important to note that in Canada that cutoff is 18, where they transition from a children's hospital into an adult cancer center. Whereas in the UK, as many of you are aware, there's the teenage young adult ward, and that's the 13 to 23 age range. Now, when we look at these two groups, or just the young adult cancer survivorship group in general, we see that the most prevalent cancer diagnosis is in men is testicular, and breast is women. The survival rate on average, it is quite good. And what that means is that the additional life expectancy is quite significant. And these survivors are facing a number of physical and psychosocial challenges. So as you can imagine, we want to look to support them. And when we look at supportive care programming, I mean, many of the concepts on this slide are not specific to young adults and are not specific to men. We know that one size does not fit all. There is that need for patient-oriented, tailored support. We need to understand what those gaps are for each of those groups. But one comment that's made quite often within adolescent and young adult cancer survivorship is around age-appropriate care. So it is mandated that there's age-appropriate care for that group. And this would really speak to different developmental stages and different ages within that range. There's also discussion around whether supportive care should be disease-specific. So should it be, tailored program content and delivery to the disease, to the treatments received related to that disease, and so forth. But there's also an interesting conversation around whether content should be gender sensitized or gender specific. And so there's quite a lot of research that's been conducted within health promotion and men's health promotion, so outside of oncology, but also inclusive of oncology, that's looked at this concept of gender sensitization. And one of the main areas that sort of started in engaging men in health promotion, it was here in the UK around engaging men in physical activity-based interventions. Now, physical activity, which is inclusive of sport and exercise, is unique because it promotes social interaction. It's associated with many positive mental health and physical outcomes. But what we saw in some of these programs that were led in the community to engage men in originally started within obesity research, was that this was an opportunity to engage men who traditionally weren't coming out to different programs and supportive care interventions outside of cancer in a very traditional male-dominated environment. So this was football fans and training work that was done here in the UK, where they engaged older men, middle-aged and older men in a football training program. They were able to bring them onto the pitch of their local football club. They were able to engage them in different education around diet, exercise, stress reduction, things like that. And there was really a strong community collaboration. And the reason I bring this up is because what we were seeing in the hospital and what we are experiencing in our research is that a lot of young people don't, and cancer survivors in general, don't want to come back into the hospital setting for their supportive care. They don't, they want to avoid that as much as possible. And so this opportunity for community collaboration was an important piece. So at the beginning of our program, we can best support men, and specific young men. We saw that young men were living with a number of physical and psychosocial challenges, that even though there were considerable advancements in supportive care available to young adults with cancer, young men were not engaging. They were always underrepresented. And physical activity taken from the community research was potentially a platform where we could engage young men in the delivery of supportive care following a cancer diagnosis. But we really didn't know how to apply this to young men with cancer. And so we took the opportunity to specifically look at the largest disease site, so testicular cancer, and work closely with the Princess Margaret to create a program of research. So I'm just going to briefly go over that program, and I'm happy to speak more to it offline, should anyone be interested in the individual studies. But this was a photo taken of one of our survivors that engaged in our intervention, and I'll just speak to how we got to that point. And it involved four studies. So 3 studies that were helping us to develop the intervention and figure out what we felt were the key components, and then a 4th study that evaluated that. And so the study was called The Balls in Our Court. And the reason that we chose that name was mainly there's something for these men who were asking for support, but not engaging in the traditional supportive care interventions that were offered at the hospital. And obviously we wanted to engage sport. So we first took a look at surveying men at the Princess Margaret. So we went into clinic and we surveyed testicular cancer survivors about their experience. We looked at their engagement with physical activity, as well as their preferences. And then we interviewed key clinical and sports stakeholders that we felt we needed input from in order to create an intervention, as well as survivors themselves. And just really briefly, so our questionnaire, we surveyed 135 testicular cancer survivors, and our first study really looked at whether satisfaction of psychological needs was in terms of traditional, satisfaction of psychological needs impacted exercise behavior, and whether that then impacted physical and mental health. And really, this is psychological needs theory framework, and whether this was then applied to a testicular cancer population. And what we found was that testicular cancer survivors were quite active as a subsample. And this is important because when we look at cancer survivors, we see lower physical activity levels. We also see that within adolescent and young adult cancer survivors. But testicular cancer survivors, being this subset of men, were actually more active, which is really interesting in terms of leveraging something that they're maybe already involved in. As we started in this talk, we're really interested in engaging them in supportive care where they wouldn't necessarily be engaging. So it's less about getting them active and more about leveraging something that is available to them to then connect them with things that they may not be engaging with. So for instance, psychosocial support. What we found was that when those needs were satisfied, there was an association with physical and mental health, and there was greater engagement in exercise, which was a mechanism that really underpinned that association. But again, if we want to talk more about that study, I can speak to it. We then took a look at preferences. So again, taking a look at the experience of testicular cancer survivors across their from diagnosis through into survivorship. And we wanted to understand their preferences and attitudes towards delivering a supportive care program in this way. We took qualitative interviews from 11 survivors, as well as the quant data that I spoke to from the cross-sectional survey. And what came through in terms of the themes was very interesting in terms of the developmental disruption when we talk about age-appropriate care. They spoke very candidly about their experience of being diagnosed with cancer at that age and where they were in their life stage. But that although they wanted to connect with other survivors and they wanted to connect with those who'd been through something similar, they didn't want to ask for help. They didn't want to put their hand up and volunteer to participate in things. And sport or physical activity more generally, what represented a way for them to engage and get back to normal. So get back on that conveyor belt of life that they may have fallen off of due to a diagnosis and treatment of cancer. There was a desire to increase physical activity, even though they were an active subset. And when you look at preferences around individual or group-based activities, we did see interest in both, but the majority wanted a combination of the two. So weren't fully committing to a group intervention, but also were not saying that they only want to engage in something that was individual, mainly, I would believe, around that need to connect. And as I mentioned before, only 25% in our sample were interested in engaging in the hospital. So there was a strong desire to be community-based or outside of the hospital setting. And not in line with some of the other physical activity literature within oncology, there was an interest in strength training, which I think, again, is age-specific. Okay, and so what we found was that testicular cancer survivors, they really spoke candidly about that physical and psychosocial challenge that I spoke of before. They acknowledged that there were gender-based social norms that were at play. They were not labeling that, but concepts of self-reliance and stoicism came through in the interviews. And physical activity was viewed as engagement in addressing other supportive care needs. So, like I said, access to different stress reduction techniques and things like that. They voiced a desire to connect with others, as I said, and they wanted that psychoeducation piece to be embedded within the activity. They had specific interest in management of anxiety that was rated quite high in their need selection, as well as identifying late effects like fatigue specifically, and interest in talking about fertility. And so these findings supported the development of a tailored supportive care intervention that we then went on to develop. But just lastly, the last study that really did look at the other key stakeholders outside of patients, so this was clinical stakeholders and sports stakeholders, looked at whether this was safe, whether we were able, so enablers and barriers to development and implementation of a program that would be community-based. So if you're getting the feel, this was very bottom-up. This program of research was very much from a bottom-up approach. And what we found was that there was quite a lot of buy-in from key stakeholders, both from a clinical perspective and sport community perspective. There was quite a lot discussed around safety and training, which was fantastic. We did discuss different enabler and barriers to intervention development, so perceived need for tailored programming for mainly to do with gender and age, as opposed to treatment type or cancer specific. It was reported to be within the scope of practice for the sports stakeholders, so they drew a lot of connections to injury and to working with breast cancer survivors and other cancer survivors or other clinical populations that they felt that with the appropriate training, they would be able to engage with. And it was discussed that group-based physical activity, as we saw from the preference paper and empirical evidence, is that group-based might be a barrier to participation for some survivors. So there's always going to be that group that we're not quite getting at, given the balance of priorities. And lastly, one of the barriers was really around scheduling and financial challenges, not only for the patients to attend, but also for the community sports stakeholders to participate in something like this. And what came from speaking to some of the sports stakeholders was the inclusion of varsity players. So this was at a university setting. We were speaking to some of the coaches and staff within that environment, and they felt that including varsity players who were of a similar age to the testicular cancer survivors could be really interesting from a perspective of peers and peer support. But also the benefit for varsity players to engage with young men who had faced cancer. And we focused on basketball mainly because of a path of least resistance to those who were willing to participate, but also because in Canada, football is not as big of a sport, and hockey is a little bit more difficult, although there are some men's health promotion programs that look at hockey, but also because it was something that they felt was quite accessible in terms of physical, where survivors were physically to come out and shoot a basketball, as opposed to something that would be much more running intensive. We then decided on delivering a strength program that would be in combination with the sport play, and we confirmed the psychoeducation content. So just a brief overview of the balls in your court intervention. So they came in, these are photos from the intervention. They came into our gym at the University of Toronto, and it was a facilitated session with a varsity strength coach. And it was an hour long, and then we went upstairs to the gym and they had an hour of play. So it was a 2-hour intervention. We also had psychoeducation, which was integrated in the cool down section. So after they had finished playing, when they were stretching and we were talking about the next week, we engaged with a workbook that was created in order to provide support for these men on the topics they had indicated in our initial studies as being their main interest. So in order to then look at feasibility and acceptability, so that intervention ran for 5 weeks. We then just did a pre-post intervention design for survey. We took weekly open-ended feedback surveys and took field notes. And then we were able to conduct a focus group at the end of the intervention with 6 out of the 10 men who were able to participate in our intervention. Just a few sort of take-home messages from this program. So attendance really did range, but when men weren't able to engage, it was mainly to do with just common colds. We conducted it in the fall, so as you can imagine, there was often someone was off sick or something like that. This was all pre-COVID. When we asked about satisfaction for the 3 components, so the sport component, that was the sport play, the exercise component, which was the strength and conditioning piece, as well as the psychosocial support around the workbook. You see that there's quite high satisfaction for the sport and exercise component, as well as for meeting their needs. However, there was not as high a response on the workbook. And so we dug into that in the focus, we were able to dig into that in the focus groups and gain recommendations for refinement around more facilitated discussion, making more time for it, because we were coming off of the court and it wasn't as prioritized, and offering it earlier in the disease trajectory. So many of these men were finished treatment and were a number of years out from their diagnosis and treatment. So they voiced that they would have appreciated that workbook content early on. And a lot of that content is very similar to what we see in the Macmillan Support guides and things like that. So nothing was very specific to Testis. We just made sure that the photos and content was very male specific. And what we saw from our pre-post design was also improvements in self-rated physical health on the individual level, but the sample size was quite small, so we didn't do any group level statistics. And so just to integrate the findings from these 4 studies of this program of research that was very bottom-up designed, physical and psychosocial health is an issue in this group, and it can persist well into survivorship, so many years out. Testicular cancer survivors particularly are followed, I know in Canada, for 10 years in our clinics prior to being kicked back to their GPs. And so this is something we have quite a lot of data on to support their experience. Survivors and clinicians endorse the need for tailored care. So this was specific to age, gender, as well as disease site. But that gender sensitized piece was very much endorsed. And community-based, in terms of getting men out of the hospital and into a community-based setting, was identified as something that can not only be feasible in terms of the development and implementation, but something that could also be preferred by patients. We also see that exercise engagement is a potential mechanism associated with health. So remember, that was the mental and physical health piece in the first study. And there's that opportunity to leverage existing interests of sport and going to the gym and things like that. And it provides a bit of a novel approach into supporting these young men. Now, this was very much a bottom-up approach in terms of our research design, but I just want to take some time to talk about a top-down approach that we were utilizing here in the UK. So Dr. Gemma Pugh had led some work working very closely with Truckstock when she was at the University College London and at Queen Mary. And she had looked at a pre-post evaluation of an already existing program. So instead of designing a program from the bottom up, this was a program that was already existing and led by a fantastic charity called Truckstock. And what she did was evaluate the impact of a one-day health and wellness event, and they're called Meet and Move. And they're delivered across the UK, and essentially they bring young people together in order to engage them in physical activity, but in doing so, connecting them with that social connected piece, connecting them with each other. And what they found was a positive impact on self-efficacy and confidence to be active, to engage with their health after a cancer diagnosis, and a reduction in worry, so that rumination and anxiety around engaging in exercise and due to things that were seen around their cancer diagnosis and treatment. And we saw an increased engagement in other programs following this Meet and Move. So kind of as an icebreaker program, this one-day event, survivors were coming to it, and then we saw an increase in engagement in other programs that were outside of this one-day event. Now, as you might have noticed, I didn't mention men, and that's because less than 10% of the participants in this were male. And so in working with Gemma and with Truckstock, Truckstock spoke very openly about how men were very underrepresented in their work and a lot of their programs that they were offering. A lot of the programs were led by women. I think that's an important piece too, in terms of how men feel when they're entering different environments in supportive care programming. But regardless, men weren't coming out. So we teamed up a number of years ago to work with men and have them come to a essentially a public engagement piece where we invited them to a place in London that allowed them to sort of have some pizza, have some play some ping pong, and we asked them for feedback to say, okay, if we were to put together another meet and move that would be male specific, would this be something that you would be interested in, and can you give us some feedback around engagement? And what we kept hearing from men, which was consistent with some of the data that from my program of research, was that men had a desire to meet other young adults. They felt very anxious but hopeful in attending, and this was obviously a sample of men who showed up. But they talked a lot about how the barriers to engagement are around some of those gender norms that we spoke about. So one man said, it's a man thing, right? We don't want to come out, we don't want to ask for help, that sort of thing. And there was anxiety around meeting new people and having to engage in discussing their cancer and something that may make them look weak. And so the suggestions that they came up with were to keep it very casual, but to make a lot of space for discussion, which was consistent with what feedback I got after our intervention around making more time and space for that chat, and more time and space for different psychosocial pieces around psychoeducation. They also very much suggested that it be a team sport based, and they endorsed the male specific. So we did say, should we have different groups? Should it be both genders, or should it be inclusive, sorry, I should say, of everyone, regardless of gender orientation. And they said, no, we wanted to connect with other men in this case. So we thought we'd give that a try. So we put together, this is a photo of the men who came to a male specific meet and move. I included this photo because at the end of the day, after we engaged in our different activities, we sort of let the leaders go out and say, just have a chat, and there's nothing that you need to cover or achieve or anything like that. And as you can see, I'm standing behind a window because we took this picture and I have consent to share it, because we just let them talk and do what they wanted. And it was absolutely fantastic what we kind of overheard and what the facilitators came back with in terms of discussions around fertility and sexual health and return to work and everything that we see in the young adult sphere, but was very specific to these guys around a table. Now you take a traditional supportive care intervention where you would have people meet in this type of environment and men aren't showing up. But after a day of activities, them getting to know each other and then providing the opportunity for this, it was very much engaged with. And so we had 17 men attend. They felt that they were more inspired to be more active and engaged in their health. They did favor the exercise piece. So there was multiple sessions that were offered, but the exercise session was the one that was the most favored. But again, similar to what I was seeing in some of our earlier work, there's a desire for more informal chat and additional games and opportunities to sort of get to know each other. So I was very happy to see that no one wanted to leave, which was fantastic. We looked at social connectedness, body image, quality of life in terms of some of the sessions that we had, and confidence to be active as well. And so that was very much a top-down approach where we took existing programs and existing structures within the charity organizations within the community in order to see how we can apply some of our lessons learned and intervene, as opposed to coming from the hospital setting where we were recruiting men from the hospital to engage in a program that, yes, was community-based, but very much we were coupled with the hospital in that way. And so I wanted to just highlight a paper of those who are interested in this topic. In 2020, there was a commentary piece published by John Olive, who is a fantastic researcher in the area of men's health and men's health promotion. And he published this paper looking at 8 lessons learned and their caveats. Now, I'm not going to go through them all. I think it's a great paper if you're interested in it. And it is very general. It's not cancer specific, but a lot of the work, so Christina Cappuccioni and a couple of the others on this paper have done work within prostate cancer and engaging prostate cancer survivors. But none of them have really focused on the young adults. There are some groups that have looked in Australia at engaging young men within the community, young men in mental health, and reducing suicide risk and things like that. But we were the first to sort of look at this within an oncology setting. But pulling from that paper and inconsistent with what we were seeing in both our bottom-up approach and our top-down approach in terms of research and engagement, was that there is this need or this opportunity for gender sensitized programming. So what I would urge everyone to think about in their clinical practice and in any research that they're conducting is to just be aware of how their patients or men are aligning with masculine ideals. Now, this could be a whole nother discussion around what are traditional masculine norms, and should we even be discussing these in 2021. But I think we can, or at least I feel that concept of self-reliance and stoicism and talking about strength and asking for help and help seeking is a concept that is still very much at play, and not just with men, but amongst many individuals. I know that if I was offered a support program, one that involved an activity versus one that was sitting around a table, I would most likely choose the activity-based. And so just a note of caution in wanting to have an awareness around this is, how we understand or how we come to understand what the intended audience needs. So I'm focusing on young adults and focusing on men, but this may, like I said, these concepts may apply to others and can apply to others, absolutely. And so we need, as clinicians and researchers, to continue to formally investigate and evaluate, not just assume that there are these social norms and then hanging our hat on that. So I just wanted to note that. And in line with that, in terms of shifting norms, so strong leadership within these programs, whether we're speaking about strong leadership from a clinician who's referring to psychosocial oncology or supportive care, or within the community, or strong leadership within community interventions, that can really give permission to other men to shift masculine norms. And we really see that within the literature as being a key component to success and why these health promotion interventions, when done right and done well, can engage men in shifting those norms. And that's really where we want to move towards. The activity-based, which I know I've spoken a lot to today, is a really important piece that we have found as kind of a conduit to engaging men. So if you can consider building an activity or an interaction into the supportive care intervention or into the program or access point, it can not only help in engaging men and getting them in the door, but also in retention. So if this is something that you want to engage in long term, it can really help with that. And the goal really is to break the ice, to engage men in social connectedness, but also, as I mentioned before, engaging them in managing their illness. So whether that be around their physical health or around their cancer specific, but also in their mental health in terms of stress reduction and overall well-being. But we also, as a caveat, which was described really beautifully in this paper, is that we also don't want to force it, right? We also don't want to say, okay, well, we want social connectedness. We know this is going to be a helpful piece, and we want to then bring them together in that way. There's a lot of commentaries around sort of that shoulder to shoulder, quiet connectedness between men. And so just making sure there's a lot of space, and we got that feedback in each of our studies that looked at this. We don't want to force that self-disclosure piece, especially around cancer. So kind of linking back into the strong leadership piece to ensure that there is someone that can really guide men towards, or just participants in general, towards speaking about their experience. Going back to some of the work that we were doing earlier around sport, and what we see in the Fit Bookends and training is that sort of camaraderie piece, right? Feeling like there's a shared discussion, which again, in the Meet and Move here in the UK, we asked whether it should be disease specific. And a lot of them felt that it didn't need to be, that, there was a mix of different diagnoses among that group that came to that meet and move, and among the group that came to the development phase as well. And they felt that it was more about gender and age and developmental stage, right, where they were in life. However, when I was speaking with testicular cancer survivors, they were very adamant that, testicular cancer was a very unique diagnosis, especially in terms of survival rates and different treatments, but they felt that they wouldn't necessarily be able to relate to someone who had a different type of cancer that might be more advanced. So it's just interesting when you think about methods of asking these questions, and kind of going back to my note of caution that we want to iteratively investigate this, because we're hearing different things depending on how we're asking it and what kind of group we're asking in that way. The activity-based piece seemed to be quite a key conduit to engaging men, retaining men, and also harnessing that connection to those important pieces that we know have positive physical and mental health outcomes. And the last piece I wanted to pull from this in terms of our lessons learned was around friendly environment. So, we spoke about sport and exercises being familiar and friendly environments that tend to foster some of those traditional masculine norms. Kind of a caution here, which wasn't discussed in the paper, but I'm sure is on some of your minds, is that we also want to be aware of not fostering negative traditional masculine norms. And I do know that some of the projects, Football Fans in Training and some of the other ones, have sort of been very conscious of this and have worked towards making sure that culture isn't perpetuated within the environment of this health promotion. So, we want to leverage something that's very familiar, but we don't want to, play into any of that sort of negativity in terms of traditional male masculinity and norms. But again, somewhere where people frequent and feel that they are familiar and friendly with that environment, again, this isn't a male specific comment, we will all feel more comfortable engaging in something that is quite distressing, and engaging in self-disclosure if we feel like we're in a comfortable environment. And that might not be the cancer center. So just to wrap up, and I think it'd be great to have a discussion about everyone's experiences in engaging men in supportive care, and how we can meet their needs and what their needs maybe even are. This work, so the bottom-up and top-down approach, was really an exploration of how we can involve young men and address that underrepresentation. We see that men do express survivorship concerns and interest in receiving support, so it's not a question of having fewer needs. And a lot of the motivation is around engaging with other young male survivors. Gender sensitized interventions that leverage activity can increase engagement, as I went on about. And if we can develop interventions that try to explore different routes, we will definitely build a more deeper understanding of what that best practice would look like. But as we know, there needs to be continued efforts in promoting the engagement of young men in our programs, whether that be at the hospital or within the community, and across the trajectory of survivorship. So from diagnosis in terms of help-seeking behavior, and Dr. Lorna Firm does a lot of work around delayed diagnosis and things like that, and right through into engaging in supportive care after cancer is maybe more in their rearview mirror. So again, just thanks to everyone that's involved in this research, as well as some of the funding support for the data that I presented. And yeah, I don't know if Guy, if we want to open up a bit of a discussion.
Yeah, so first of all, Anika, thank you for this very thorough and very enjoyable presentation. I think it gave a lot to think about. So first of all, if you have any question, you can write it in the chat. I guess first of all, I have a few questions, if that's okay. Do we have any update on how the program is doing in the current, since the study?
Yes, so you mean the one in Toronto?
Yes.
Yeah, or the Truckstock, or both.
Mm-mm.
That's a great question. So the University of Toronto sort of absorbed that program as something that they were going to look to do again, and we had some ideas around refinement and around involving community members. We had an idea to engage like fathers and sons and things like that, but COVID hit essentially right after all this finished. So I know that to date, nothing else has been done with this, but there's opportunity for that. Dr. Rob Hamilton, who is the main surgical oncologist in Princess Margaret that cares for testicular cancer survivors, he was absolutely loved the program, came out, and so he was trying to keep that connection, but nothing has kind of come of that since because of COVID. And I can speak a little bit to Truckstock, although again, I haven't had connection with them lately, but I know that their Meet and Move, that a lot of their programs, they've gone online, they've done a lot with survivors and how to adapt within COVID. And they've also continued to offer male Meet and Moves all across the country. So here in the UK, they've had a number of different male meetups and engagement programs that were male specific. And coming back to that leadership piece, I know that for them, a lot of their sort of key champions within that side have led programs across, Manchester, Liverpool, London. I've seen different advertisements for male specific programs.
Because again, that's my question. My follow-up question was about the leadership, because the leadership, specifically the leaders from the community, sounds like such a pivotal part. Mm-hmm. How do you begin to identify them, or what's the process of finding a champion? And because it's not like actually they were so engaged in the intervention. What was that process like? How did you find them, basically?
Yeah, so at the Princess Margaret, it's a great question. At the Princess Margaret, we were able to connect with sort of leaders within that. So the young man photo in that magazine that I showed in terms of the purpose of that bottom-up program of research, and they volunteered. So they were asking their oncologists, they were asking me when they came in for counseling, how do we start up these programs? And again, I think that it's very age specific as well, where men were connecting with, startup companies and different programs within the community, and very motivated. So they presented themselves. We didn't actually engage in any recruitment of champions within this group. But again, just as a comment, because I'm not sure how it is in the UK for testicular cancer specifically, obviously with TYA, there's the ward, but within testicular cancer survivorship, there's a clinic that is only for testis, and they bring together surgical and medical oncology, and on Fridays, they would see all testis patients. So it's a very unique group in that within the Princess Margaret, because they come together on a Friday. Everyone in the waiting room is a young male with testicular cancer or being investigated for. And so there was a lot of opportunity to sort of have that normalcy of discussion with their doctors, as opposed to when I've spoken to other young survivors who were part of other disease sites, who may be, next to someone who is older or of a different gender, then there was less of that. So to go back to your question, this group was very much, they volunteered. They put up their hand and said, we want support, we want to engage, but we don't want to engage with what's been offered, and how do we connect?
Thank you. And I would like to go to the last point that you made about how not to perpetuate negative stereotypes. I think that's talking from my personal experience of attending several support groups. From my very anecdotal experience, what I've noticed is sometimes if we don't exactly have an activity or regard, it actually tends to happen in a sense. A lot of this gender, masculine norms of kind of not talking about issues, or in a sense, almost putting kind of like this masculine facade, sometimes take over, especially over support groups. And then we see that if it's not, let's say, if it's not gently guided, we can see this taking over, and then actually there is less vulnerability, less place for open discussion. And it can also, as you said, almost be counterproductive or counter psychological well-being and discussion.
Absolutely. And as you can imagine, within a sport environment, that can really run rampant, right? So, you know, one of the reasons I really enjoyed John's article was because it was lessons learned and caveats, right? So it wasn't just, you know, here are all the things that have gone really well. Here is the exact same concept as being a potential cautioned issue. And so, for instance, in some of the work that we've done, one of the themes that came out that I presented in the qualitative work was sort of that locker room method, that idea of, you know, while they're getting ready, while they're changing, you know, there's a lot of sort of just icebreaker conversation and connectedness that happens. And we see that within the community of men's health more broadly. But in that locker room, we also know a lot of, you know, negative behavior can be fostered. So I think it comes back to that strong leadership to break down those norms and that behavior, and to monitor that, and also have strong leaders within the programs, right? So keeping a really close eye as well as researchers and clinicians.
And I guess kind of my final question, if you were to implement this kind of program, you know, the Bolted in your Court in the UK, now with that knowledge of all of the research that has been done, how would you approach it? What would be the approach?
That's a big question.
Yes.
Yeah, I've always envisioned the football fans in training program here has been so strong in the UK, and I mean across the country, and so taking something from that and leveraging it within the cancer, very similar to a Truckstock sort of idea, and having a sports day within young adult cancer survivorship, or teenage and young adult cancer survivorship. One thing that Truckstock does really well is they also have a higher age range, so it doesn't cut off at 23. They include it in their 30s, and it is much more of an older group. I think the average age of our meet and move was around 30, 31, and so I would take that approach. Again, very different from Canada. We don't have the same community engagement with charities. And I think that is such a strength here in the UK, between the hospital, the university, and a charity, and being able to put together a program that would be sport-based, that could be for teenage, young adult cancer survivors, and implement that within a community and foster that collaboration with a university where there's interest, within a charity where there's a lot of engagement within the community, and then within a hospital where we can bridge patients with care, as opposed to having them come back into the hospital, which is obviously not very conducive for playing a sport.
Excellent. Thank you very much, Anika. I would leave the stage open if there's any questions. And as I'm just conscious of time, so thank you. So I would like to again thank you, Anika, for this very thought-provoking presentations. With regards to our supportive cancer care forum, if you would like to be added to our circulation list, please contact lalita@nhs.net. Please send us your feedback. I'm just going to pop it into our chat, and then we'll send a certificate of attendance. Our next session is actually with a colleague that Anika mentioned, Dr. Lorna Fern, on 16th of December, Teenage and Young Adult Cancer, Age Matter. And also to say that I would upload this presentation on YouTube, and I really would recommend everybody to send it around. So again, Anika, thank you so much for sharing us and joining us today. And very much looking forward to hear about where this takes you forward.
Thank you for having me.
Yeah. Well, looking forward to see you everyone again on the 16th of December at 8 a.m. Have a lovely day.